Hello and welcome to this video where I will talk about the PHQ-2 and the GAD-2 measures. I will introduce what these measures are, talk about how you can ask the questions, how you can score, and how you can feed back to the patient at the end. At the end of the video, there will be a demonstration. Generalized Anxiety Disorder 2, or GAD-2 as it's known, only consists of 2 questions and is a super easy way to screen for generalized anxiety disorder and some other common anxiety disorders. The Patient Health Questionnaire 2, or PHQ-2 as it's known, also just consists of 2 questions and is equally easy to screen for depression. These 2 measures are brilliant to use if you want to find out if somebody is suitable for primary care interventions. So how do you ask the questions? Well, you begin by introducing the measure to the patient and explaining that they can be useful to screen for anxiety and low mood and depression. Which can then get them the support that they might need. So for the GAD-2, the patient would be asked, in the last 2 weeks, how often have you been bothered by the following problems? The first problem is feeling nervous, anxious, or on edge. And the options for the answers are not at all, several days, more than half the days, or nearly every day. The patient will then give their answer. The second problem is not being able to stop or control worrying. And again, the options for the answers are not at all, several days, more than half the days, or nearly every day. And then the patient would give their answer. For the PHQ-2, the patient would be asked, in the last 2 weeks, how often have you been bothered by the following problems? The first one is having little interest or pleasure in doing things, and the options for the answers are not at all, several days, more than half the days, or nearly every day. The second question would be feeling down, depressed, or hopeless, and again, the answers would have the options between not at all, several days, nearly half the days, or nearly every day. And the patient would then give their answer. So, how do you score? The answers fall within 4 different categories, as you've heard. Not at all, several days, more than half the days, and nearly every day. Each answer has a score ranging from 0 to 3. So not at all has a score of 0, several days has a score of 1, more than half the days has a score of 2, and nearly every day has a score of 3. The total score is obtained by adding the scores for the 2 questions. So the total score could range between 0 and 6. The score of 3 would be considered the cut-off point for further intervention in primary care. So if somebody scores a 3 or above, they should be offered an assessment in primary care. But if they score a 0, 1 or 2, they can just be offered a leaflet for future reference. So, feeding back to the patient. Once you've obtained the scores, let the patient know what this indicates. So, as I've already said, a score of 0, 1 or 2 indicates that the person may not need any more support and can be given a leaflet for future reference. But if they score 3 or above, this indicates that they could benefit from further assessment and intervention and primary care. So you can suggest to them that you can make a referral to primary care for further support with their consent. Okay, so now there's going to be a demonstration of what this looks like. Hello.
Hi.
Hi, I'm Sophie.
Hello.
Hi, and you're Mr. Evans. Do you prefer Mr. Evans or Joe?
Joe.
Joe. Okay. Hi, Joe. How are you today?
Not bad. Yeah, bit nervous, but
Okay.
I'm okay. Okay.
This shouldn't be too painful.
Okay.
I'll try to make this as painless as possible.
Thank you.
Okay. So, as you may know, Joe, lots of people are affected by anxiety and depression.
Yeah.
So what I'm hoping to do today is just to see if this is something that you may be affected by, and to see if that's something that we can support you with.
Okay. Sounds good.
It sounds all right? Okay, so I've got two screening tools here, one for anxiety and one for low mood depression.
Okay.
So I'm going to ask you these questions, and they've got some options for the answers. So I'll go through all that with you.
Okay.
All right. So in the last 2 weeks, how often have you been bothered by feeling nervous, anxious, or on edge? Not at all. Several days, more than half the days, or nearly every day?
I guess I feel on edge and a bit nervous when leaving the house, but also thinking about leaving the house and planning to go out, stuff like that. So probably every day.
Every day, okay.
Yeah.
So nearly every day.
Yeah.
And over the last 2 weeks, how often have you been bothered by not being able to stop or control your worrying? Not at all. Several days, more than half the days, nearly every day.
Sometimes I can distract myself, which helps a bit. So probably more than half the days. Yeah.
More than half the days?
Yeah.
Yeah, okay. So, okay, that's great. And the other screening question here, of the last 2 weeks, how often have you been bothered by having a little interest or pleasure in doing things? Not at all. Several days, more than half the days, or nearly every day?
Probably nearly every day.
Nearly every day,
Yeah.
okay. And then again, over the last 2 weeks, how often have you been bothered by feeling down, depressed, or hopeless? Again, not at all. Several days, more than half the days, or nearly every day?
Probably in between, more than half the days. Yeah, probably more than half the days actually.
More than half the days?
Yeah.
Okay. So just thinking about your answers there, Joe, there is some indication here that you may be affected by anxiety and low mood depression.
Okay.
Would you say that's accurate?
Just how I've been feeling, but I guess it's, I'd say that's pretty fair. Yeah.
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 Yeah, that's how you've been experiencing things.
Yeah.
Okay. I'm wondering then, Joe, if we should refer you to have some further assessments so that you can get the support that you need for this.
Okay.
What do you think about that?
I guess a bit nervous about it, but it would be nice not to be feeling this way.
Yes, I can imagine. I can imagine if it's affecting you as much as it is, that would be nice for you.
Yeah.
Okay. Well, let's see if we can start that process.
Okay.